Hello everyone, welcome back to the channel. Our today's topic of discussion is anatomy of tympanic membrane. So, the dimensions of tympanic membrane are 9 to 10 millimeter height and 8 to 9 millimeter width. And the tympanic membrane is about 0.1 millimeter thick. So, the tympanic membrane is a partition between the external auditory canal and the middle ear. It is positioned at an angle of about 55 degree to the external auditory canal. So this is the external auditory canal and this is the tympanic membrane. So it is at an angle of about 55 degree to the external auditory canal. So what are the parts of tympanic membrane? So basically tympanic membrane can be divided into two parts. One is the pars tensa, another is pars flaccida. So pars flaccida is also known as shrapnel's membrane. The major part of the tympanic membrane is formed by pars tensa. The tympanic membrane is thickened in the periphery and it forms a fibroelastic cartilaginous ring which is known as tympanic annulus. And this tympanic annulus, this fits in the tympanic sulcus. Next is the umbo. It is the centralmost part of tympanic membrane near the tip of the malleus. And it is the most prominent part of the tympanic membrane. Next is cone of light. It is a bright light which is seen in the antero-inferior quadrant of tympanic membrane during otoscopy. And this bright light radiates from the tip of malleus to the periphery. Next is the pars flaccida. It is also known as shrapnel's membrane and it is situated above the lateral process of malleus. Suppose if this is the malleus and if this is the lateral process of malleus, then pars flaccida is above it. So this pars flaccida is situated between the notch of ravenous and the anterior and posterior malleolar folds. So what is notch of ravenous? So basically notch of ravenous, it is also known as tympanic notch, is a natural defect. So it is a natural defect in uppermost part of bony ring, that is tympanic annulus, that supports the tympanic membrane within temporal bone. So let me draw a simplified diagram for you. So suppose this is our tympanic membrane. This is the handle of malleus. So this one is the handle of malleus. This part posteriorly, it is the posterior malleolar fold This is the anterior malleolar fold. This entire part is the pars tensa. This part above the lateral process. So this is the lateral process of malleus. So the part present above the lateral process of malleus is pars flaccida, and this is situated between the notch of Ravenous. So this is the notch of Ravenous and the anterior and posterior malleolar folds. Another name for handle of malleus is manubrium, and the tip of the handle of malleus is known as umbo. It is the most prominent part of tympanic membrane, and it is the point of maximum convexity. The cone of light always falls in the antero-inferior quadrant. So this is the inferior quadrant. So the cone of light always falls in the antero-inferior quadrant. So this is the antero-inferior quadrant, and this is cone of light. So a normal tympanic membrane, it is shiny and pearly gray in color. Its lateral surface is concave and it's more marked at the umbo. This is the umbo, which is the point of maximum convexity. So the degree of transparency of tympanic membrane differs from individuals to individuals, and a few structures that can be seen from outside via otoscope is, one is the round window. So it lies somewhere around here. So this is our round window, and one we can see over here is the incudo stapedial joint. This part, it is the lateral process of malleus. This part outside, that is in the periphery, it is the tympanic annulus. What are the layers of tympanic membrane? So basically it is divided into three layers. One is the outer epithelial layer. In the middle there is middle fibrous layer, and the inner part there is inner mucosal layer. So the outer epithelial layer, it is continuous with the ESC skin. The inner mucosal layer, it is continuous with the middle ear mucosa, while the middle fibrous layer, it consists of three types of fibers, that is radial fibers, circular fibers, and parabolic fibers. The middle fibrous layer is quite thin in pars flaccida as compared to pars tensa, and it is also not as organized as it is in case of pars tensa. Next is the nerve supply of tympanic membrane. The medial surface of tympanic membrane is supplied by tympanic branch of glossopharyngeal nerve, that is Jacobson's nerve. The lateral part of tympanic membrane is supplied by two different nerves. The anterior half of tympanic membrane in the lateral surface is supplied by auriculotemporal nerve, which is a branch of mandibular division of trigeminal nerve. The posterior half of tympanic membrane is supplied by auricular branch of vagus nerve, which is also known as Arnold's nerve. Next up is the blood supply of tympanic membrane. The tympanic membrane receives dual blood supply. The lateral aspect of tympanic membrane is supplied by deep auricular artery, while the medial aspect of tympanic membrane is supplied by anterior tympanic artery and posterior tympanic artery. The anterior tympanic artery is a branch of maxillary artery, while the posterior tympanic artery is a branch of posterior auricular artery. Next is the venous drainage. The superficial aspect of tympanic membrane, it drains in the external jugular vein, while that of the deep surface of tympanic membrane, they drain in the transverse sinus and dural sinus. So this is a simplified video about the anatomy of tympanic membrane. Thank you for watching. See you guys in the next video.